Welcome to the Rehab Psych Lab's presentation on Internet-Delivered Cognitive Behavioral Therapy for those with stroke, the development phase. My name is Randy Upper. While approximately a third of stroke survivors experience post-stroke depression, PSD, or depressive symptoms, only 2 to 3% access mental health services in Canada. Individuals with PSD are at a higher rate of suboptimal recovery, recurrent vascular events, poor quality of life, and mortality. Depression is related to greater health care burden and costs. Those with inadequate depression care had more outpatient and emergency department visits and greater annual outpatient costs compared to adequate care. Cognitive behavioral therapy, CBT, aims to provide people with increased coping ability and self-efficacy by helping them identify and reshape their thoughts, emotions, and behaviors that can be maladaptive to effective rehabilitation process. There is strong evidence for the positive effects of CBT on symptoms of depression and remission rates post-stroke. The main objectives of this research project are: 1. Tailor an existing ICBT course to meet the needs of people who have experienced a stroke, and 2. Identify needs, potential facilitators, and barriers that can influence implementation and use of the course. An 8-member, patient-oriented research panel will work in collaboration to tailor an existing ICBT course to ensure specific needs of individuals who have experienced a stroke are met. The panel consists of clinicians, researchers, care providers, and persons with lived experience. Panelists will attend 3 one-hour virtual focus groups whereby, through an iterative process, they will identify and discuss important stroke-specific topics, gaps in the existing ICBT course regarding the needs for those with a stroke, and provide feedback on course content and presentation. To date, we have had 1 focus group, and the following themes were identified. Results regarding stroke-specific content were: inclusion of stroke-specific vignettes, modules to target cognitive symptoms related to memory and attention commonly found among those with stroke, and additional resources such as communicating with a partner. Results regarding non-content related considerations: provisions of mid-lesson summaries, use of visuals and audio, readability of content, use of memory aids, and usability of the web platform. Results regarding program delivery considerations: pace of delivery, length of course, availability of tech assistance, amount of guided support, and appropriate time to offer the course during the recovery process. Results regarding implementation factors were involvement of care partners, language and comprehension levels, comfort with technology, and collaboration with community organizations. Due to barriers such as suspension of rehabilitation programs during the COVID-19 pandemic, as well as geographic dispersion, adoption of telemedicine for delivering healthcare programs has become critical. To help improve healthcare access for patients with stroke living in remote or rural areas, and during times when public health measures require physical distancing, there may be a need to virtually deliver healthcare service via internet. The tailored program overcomes several limitations to engaging in the general ICBT program, including concerns related to reading, memory, and comprehension requirements. On behalf of myself and the rest of the team listed here, we would like to thank you for your time and interest in this important project.